Nasir El-Rufai, governor of Kaduna State, has faulted statement credited to philanthropist and founder of Microsoft Bill Gates on Nigeria's economic plan. Bill Gates at the expanded National Economic Council presided over by Vice-President Yemi Osinbajo said that President Buhari's Economic Recovery Growth Plan (ERGP) does not truly reflect the needs of Nigerians. The Nigerian government's Economic Recovery and Growth Plan identify investing in our people as one of 3 strategic objectives. But the execution priorities don't fully reflect people's needs, prioritizing physical capital over human capital, Gates had said. Reacting to Gates' comment, El-Rufai, who was among the governors at the meeting where Gates spoke, said the Nigeria's economy plan had enough provision for human capital. On the review of ERGP as suggested by Gates, it is not correct to say that the Economic Recovery and Growth Plan does not give primacy to human capital. It is not correct. El-Rufai said, the Economic Recovery and Growth Plan has enough provision for human capital. It is a federal government plan. What is needed is for states to have similar plans as well as adequate provisions for healthcare and education. Because the bulk of the burden for healthcare and education really rests on states' governments. The disease burden of the country is largely at the primary healthcare level, and this primary healthcare system is broken completely. We need to rebuild it. It is the responsibility of the states rather than the federal government. The federal government incentivizes with funding, grants and aids. But essentially, routine immunization, primary healthcare, is the responsibility of the states. So, it is not gaps in the ERGP that we are looking at, it is appealing to states' governments to provide more money in basic education, primary healthcare. It is not the ERGP that needs adjustments, it is the budgeting that needs to be ramped up in these 2 key areas because these are where the problems are. If a child loses equality education, he is done for life. If a child doesn't get quality healthcare in the first 2 years, he is destroyed for life. This is the message that we invest more at the lower level, so that we prevent this disaster from happening, he added.